in Illinois and across the country are experiencing higher rates of mental health problems for which they need services. And in some cases, they may even require intensive services like inpatient hospitalization or residential treatment. According to the U.S. Surgeon General, children wait an average of 11 years from the time a problem is first detected until appropriate treatment is received. I'm Dana Weiner, a clinical psychologist and senior policy fellow at Chapin Hall. I'm also the Chief Officer for Children's Behavioral Health Transformation out of the office of Illinois Governor J.B. Pritzker. I'm happy to say that today, navigating the path to services is less confusing for families than it has been in the past. Over the last 3 years, a team of experts at Chapin Hall has collaborated with state government leaders, providers, key stakeholders, and parents and youth with lived experience to redesign and fundamentally change the way families access behavioral health care in Illinois. Following a blueprint for transformation developed by a Chapin Hall team led by me, we have built technology, improved processes, and developed new service types to ensure equitable access to behavioral health care for all Illinois families. The blueprint describes a vision for transformed children's behavioral health services, and it has provided a clear path for streamlining access to needed care for families and children. The plan focuses on 5 goals. They are to adjust capacity so that we have enough of the services we need, to streamline processes so that services can be easily accessed by families, to intervene earlier so that we can prevent acute crises, to increase accountability so that there's transparency in service delivery, and finally, to develop agility so that systems can be responsive to the changing needs of young people. This plan depends on a coordinated response among multiple state agencies and the technology and processes that make this coordination possible.
I'm Regina Kreider, a senior policy analyst at Chapin Hall. I'm a firm believer that families can solve their own problems when given an opportunity to do so. I lead blueprint strategies that focus on elevating community supports. Specifically, I lead recommendations 11 and 12, which focuses on elevating family leadership and workforce opportunities for people with lived experience. One critical support that we launched during this initiative is the Beacon Portal. The Beacon Portal is a centralized resource for families in Illinois who are seeking behavioral health supports for their child. In the first year of launch, which was August of 2024, there were more than 26,000 distinct visitors to the site. This portal takes the mystery out of how to find services for family in Illinois, and this leads to faster and better outcomes for children.
I'm Kil-Jun Kim, a policy fellow at Chapin Hall. In this transformation initiative, I mainly work with the Illinois State Board of Education, also known as ISB, to support the implementation of universal mental health screening across school districts statewide. So far, the initiative has helped advance legislation that will require all Illinois school districts to offer universal mental health screenings to students in grades 3rd through 12th by the school year 2027. Illinois is the first state in the nation to take this step. Now comes the hard part: coordinating efforts among stakeholders across the state, including ISB, to implement the screenings effectively, and ensuring that students who are identified as needing support can access services in a timely manner.
Over the next year, we will continue to work toward full implementation of the blueprint by preparing school districts to offer universal mental health screening, adding to the technological infrastructure, and strengthening communities across the state by partnering with parent leaders to promote health and well-being for all Illinois youth. Chapin Hall is committed to elevating evidence-based solutions to guide practice, achieve equity, and promote well-being. You can learn more about the Illinois Behavioral Health Transformation Initiative at chapinhall.org/transformation blueprint.